Well, hospital visits can be daunting for kids, of course, but virtual reality is helping transform the experience for patients at Children's Hospital Los Angeles, reducing their pain and anxiety during procedures. Well, Dr. Jeffrey Gold is the director of the Biobehavioral Pain Lab at Children's Hospital LA, and he's here to talk about the advancements in healthcare. This is so wonderful to hear, Doc.
Thank you so much.
Thank you for being here. You've been looking into the use of virtual reality for 2 decades, right?
Correct.
Can you talk about the technology itself and how it's being used to manage anxiety in pain management?
Yeah, we have children that come through often for painful medical procedures. So we'll often immerse them in technology that have them engaged and playing in adventures during that painful procedure. And what that does is it reduces their anxiety and their pain experience. Often you'll hear kids say things like, "Oh, have we even started the procedure yet?" And we'll say, "Well, we're already done." So that can be for blood draw, lumbar punctures, for IV starts and things of that nature. So, and you know, what's really great is you see that benefit for the patient, but you also see it for their parents, because if the child's feeling calm and relaxed, then the parent also feels really terrific.
Yeah, good for the parents too. Now, Dr. Gold, you brought a pair of headsets to show us. This is what we're talking about. So describe, when children have these VR headsets on, what are they seeing? Help us visualize, and how does it help the brain process the pain?
Yeah, good question. So with these headsets, it's very deeply immersive. So they're very engaged, and it's really operating in the brain in a way that focuses their attention on this adventure or this game or this movie or this task, as opposed to being overly focused on the procedure. So people often talk about it as being distraction, but we know neurobiologically it's very different than just distraction. You're actually using your brain to turn down the sort of painful or anxiety symptoms that are coming up inside of your body. So that's what it does. It kind of like dampens. We call it top-down inhibition. So it's dampening those incoming signals by focused attention and immersion in that adventure or that game or that movie.
So cool. It's kind of like canceling the pain, the focus on the pain.
Exactly.
Love that.
And we see that like with mindfulness and deep breath work and meditation. It's the same thing. You're using your frontal lobe, part of your brain, to dampen incoming signals that would be distressing, be them pain, anxiety, sadness, whatever that might be.
I love that. Doctor, it wasn't just the children who had better outcomes using VR.
Correct.
We're talking about caregivers, healthcare providers.
Yes.
They also had a better experience during procedures. Explain why.
Yes. Well, we call it the triangulation, right, of data. So we're getting information from the patient themselves, from their caregiver, their parent, their auntie, their uncle, and also the healthcare provider. And what we're learning is that when the procedure goes smoothly, then everyone's happier. And so that's what's happening is the child is comfortable, they're not having pain or anxiety, or they're having little, and then the healthcare provider is able to do their procedure quickly, and the parents or caregivers are also really happy. So it's really important to get multiple perspectives and ratings from the whole environment or the whole culture.
Great to hear. Doctor, show us what you brought here. These are the headsets, obviously. What are we looking at over there?
Well, what is a big problem for a lot of companies that are delivering VR is that everything's in the headset. And so we'll put the headset on the child, and then maybe it's not operating properly. There's an error. So we'll pull it off of the child, and we'll reprogram it, and then we'll put it back on it. There's a company called Sync VR that actually created this to the iPad. So what happens is you power on the headset, and you put that on the child, and you can drive everything, all the games, all the adventures, all the sort of choices you need to make for that experience through the iPad. And you can actually see what the child's also seeing. And the newest adventure that's going on with VR is you have pass-through now. So some kids don't like to be fully blocked, so they can watch the game or do the adventure, but also see the environment around them. So that's called augmented reality.
Augmented, we've heard of that.
Yes,
that's right.
So that does both of that.
Okay, and before we let you go, I have to ask you about this. CHLA also uses, I love this, yoga.
Yes.
Acupuncture and other tools to teach pain management skills. How can these techniques improve a young patient's physical as well as mental health?
Yes. So we currently are recruiting for research purposes patients who have pain, and they can come from pain or palliative care or rheumatology or hem-onc or even rehab medicine. And what we're doing is we're offering them these services, and what that does is it can decrease pain. It can also increase comfort. And so we're collecting data on that right now and have been for the last few years to be able to bring those types of what we call integrative medicine practices into our culture and into our environment and offer that to patients. And we're seeing really terrific outcomes. We've been looking at some of that data right now.
That's what it's about today, right? Integrative, not just just one way.
Correct.
Several ways.
Yeah, whole person health.
Yeah.
Whole person health is really thinking about their biology, their psychology, their social, and their environment circumstances, and trying to integrate all of that through our care.
You know, Dr. Jeffrey Gold, thank you so much for
Thank
what you do and for what CHLA does on a daily basis.
Thank you so much for having me.
Appreciate
it.
All right, 8:16 on your Monday. Let's get over to